Hey guys, just wanted to introduce you to Jeff Mercer. He is the director of our mental wellness department here at Aptiva, and we'd like the opportunity to introduce you guys to him and his team and let him share a little bit about some of the things that he's excited about for the mental wellness department. So if you guys, with no further ado, if you guys could turn the screens here to Jeff Mercer. Jeff, you're joining us here this morning, right?
Yes.
Awesome.
Thank you
Appreciate
for
you
the
being.
opportunity.
Absolutely. We appreciate you being on here. So, for starters, can you just give us a little background on who you are, where you came from, and what brought you over to Aptiva?
Absolutely. So I've been here approaching 2 years, um, and excited to grow this department. Historically, I've worked with a lot of different populations. I've worked with trauma victims, incarcerated youth and adults, male. I worked a few years with severely brain injured patients. I've worked a lot with emotionally and behaviorally dysregulated patients. Um, I particularly enjoy couples therapy and have a wide variety of experience in the last 26 years. I particularly enjoy working with individuals and couples that are interested in not just recovering from traumas, but using their hardships to become a stronger, more resilient person as they move forward with their lives. Um, in relation to growing this department at Aptiva, I've successfully built treatment departments. One was for the Department of Juvenile Justice, and I've grown and developed private treatment facilities. I had my own private practice that grew to 15 therapists, including medical doctors, a wide variety of psychotherapy providers. We were in 3 different locations here in the Louisville metro area. And so when I became aware of this opportunity at Aptiva to start up and grow a mental wellness department, this felt very familiar to me. I had retired early once and had decided I was not finished uh, trying to make an impact in this world. And at the time that I heard of this opportunity, I was at one of the local mental health hospitals. And this just felt familiar and exciting. I think I'm equal parts psychologist and entrepreneur. So this is a lot of fun for me. In the last 2 years, we have grown from just me to 2 other psychologists, a neuropsychologist, and a psychiatric nurse practitioner. And we have a lot of growth planned for the future.
That's exciting. I love the piece you touched on the unfinished business. It's like you still had that yearning and that calling to want to do more. And I think that it shows up in your passion because we get a lot of good feedback from both employees and patients alike telling us that they could just sit and talk to you for hours because you make them feel so comfortable. So I'd attribute that to the posturing that you bring into those conversations. Jeff, more specifically, like what are some things that your team does to approach the mental wellness that might be a little bit different than what somebody's used to when they hear the term mental health care or mental wellness in general?
Yeah, so we lean heavily on prevention. When a patient first comes to us, a lot of them have experienced traumas and significant hardships. And there's a bit of time of venting and some psychoeducational pieces that go with that. But before the patient leaves us, we want to not have just returned them to their former state. We want them to walk away from Aptiva better ready to withstand the hardships of life. And I think that's a bit different than the approach of many therapists in the community. We take a biological, psychological, environmental approach, environment obviously including social. And so we treat the whole patient. We don't just treat parts of the patient. And that's one of the things that really excited me about coming to Aptiva, is that we have an integrated team at Aptiva. It is not uncommon at all for an orthopedic surgeon and a psychiatric nurse practitioner and a physical therapist and myself to all be in an email discussing a patient's needs. And that is exciting for someone like myself that treats the whole patient. That's an opportunity that I've rarely gotten in my career. Integrated healthcare is exactly where all the healthcare needs to go, and we literally are on the cutting edge of that here at Aptiva. Sort of hand in glove with all of that is a good therapist, a good psychologist always works diligently to work themselves out of a job. So we're not here to keep the patient coming back. We are here to help that patient learn to meet their own needs as much as possible in the future so that they don't necessarily need these services again. Now, if they do, obviously that's something that we provide, but we want to empower that patient to leave our offices with the ability to meet more of their needs than they had the ability for when they first came to us.
Yeah, I hear that message for sure. We talk about it with our patients a lot. You know, our job is to give them the tools in physical therapy. We want them to have the tools so that they feel like they can handle their pain on their own once they leave us. So we can definitely relate to being able to join forces in that way. And you said, you know, work yourself out of a job. It's somebody hears that and they think, that doesn't sound like sustainability. But tell me a little bit about how that work yourself out of the job thing. How does that lead into more patient referrals? Like, what's the advantage for the patient side of that?
So for 26 years, I've adopted that approach. And interestingly enough, when that gets out into the community, you get more referrals sometimes than you can meet the demand for, because people want to be empowered. They intuitively want to be empowered. They want to be able to manage and direct their own lives. And one of my very first patients in private practice was a young lady. I remember it was 333. She was 33 years old and had 3 children and had come 30 miles to our practice. And when she walked in, it was very apparent quickly that she was not at a good place. And we sat down and started building rapport and discussing her situation. And because we treat the whole patient, we were getting her medically cleared at several different levels before we jumped to mental health diagnoses. Part of that involved a sleep study. And a long story short, this young lady who was just sure that she had some pretty significant mental health issues was in fact suffering from severe sleep deprivation. Got that straightened up and she was good to go on with her life. And one of the interesting conclusions of that was, even though she drove 30 miles to get to us, she came back to personally thank us for not slapping a mental health diagnosis on her and treating her for multiple years, but actually getting to the root of the problem and empowering her to move on with her life. And that's really what we're about. We're not about anything other than getting our patients to a point where they can move on with their lives in a healthy way.
Wow, that's a cool story. It's super encouraging because it seems like in the world of healthcare in general, patients come in and they get a diagnosis. You've got hip pain, you've got ADHD, you've got post-traumatic syndrome. There's all these labels that you get put on. And it sounds like that's the approach that you guys take with regards to helping that patient beyond the diagnosis, right? So what are some things as far as your experience here with Aptiva that you've had in the last 2 years? What are some cases or scenarios? The more of the question I think I'm asking you is, what types of things are presenting to you that may typically get just a diagnosis that you guys are able to hold hands with their patients and then walk through that journey with them?
Yeah. So people who experience a trauma, and most of our patients are people who've experienced a trauma of some sort, often a personal injury trauma. But people who experience traumas, a couple of indicators that they may need outside assistance, outside of their own head assistance in dealing with the trauma, is if they've had former traumas in their life, and if those traumas have led them to be emotionally and sometimes even behaviorally dysregulated. And so often when a patient has experienced hardships in their life significant enough to lead to that dysregulation or that hypervigilance to threats in their life, when they come to us, they're not it takes a therapist with some experience and some understanding to look past some of those traits and see what the underlying issues are and to address those. And that does not always happen in the mental health community. To look past some of the symptomology and to look at those deep undercurrents that occur. And so when those patients come to Aptiva, we're not here to label and pass some sort of clinical judgment. We're here to help that patient reach deep into their psyche, if you will, and work on those things in a way that is sustainable and that helps them to address life in general when they leave our four walls.
When patients experience trauma, like what is it that they're going through, or what are they experiencing when that pain hits their body? What happens to the patients when they encounter that trauma?
We humans don't really live in a world where we have, at least in first world countries, we don't really have too many ongoing everyday threats to life the way we did centuries ago. And so we have an autonomic nervous system. A lot of people will know that as your fight flight syndrome. But it is very much a hardwired physical part of our bodies that interacts with our neurology, our mental health dynamics. And what the function of the ANS is to protect us, to see threats and react to them in a way that is protective. And so the success of the human species to a large degree has been dependent on our ability to do that well. And we do. But because we now live in a world where we don't look for tigers and bears around every corner, it's sort of as if the autonomic nervous system is a bit outdated. And so, a few hundred years ago, if we were walking down a trail and our five senses, or some of them at least, indicate to our subconscious that there's a threat ahead, we would process that subconsciously. And the subconscious would sort of say, yep, that's a threat, and would sort of push that up to the conscious level. We would consciously evaluate, and all this would happen in nanoseconds, right? Very quickly. And consciously, we would say, yep, that's a serious threat to our lives. And it would send a little message over to the limbic system, to the emotional centers of the brain, to indicate that we need to be scared. The limbic system would send a message down the 10th cranial nerve to the adrenal glands right above the kidneys. And the adrenal glands would spit out some cortisol and adrenaline, and a couple little squirts of that. Those messengers go over to the organs, and we breathe heavier, our heart beats faster, our intestines would shut down. And the brain and body does the coolest thing. It takes a little blood from the intestines, because we don't need to digest food if we're fighting for our lives or running for our lives. A little bit of blood from the brain. We don't need to do calculus if our life is in danger. And repurposes that blood, or reallocates that blood to the arms and legs so that we can run or fight. And even more cool, if it perceives that we need to run, it'll put more in the legs. And if we need to fight, it'll put more blood in the arms to enable us to do that as best we can. That system does not know the difference between a lion and an auto accident, or an accident in the workplace, or an angry supervisor, or a conflict within the family. Now, it knows the difference in magnitude, so it will react much more strongly to an auto accident than it would to some perceived social threat. So it knows the difference in magnitude, but other than that, that scenario plays out at some level when we feel ourselves to be threatened. And so when people are in auto accidents, they often report that their hands are sweaty, they're breathing hard, their heart is pounding, they feel like they're having panic attacks in some circumstances. So all those same physiological and mental dynamics occur that would happen if they were, trying to not get eaten by a tiger. So when people come to us here at Aptiva, we help that person return that system back to its baseline state, so that they're not waking up in the middle of the night with their brain screaming, am I okay? Am I okay? Are we all right? So that they're not irritable, that they're not overly emotional for what appears to be no reason. So there's a good bit of education that occurs that allows that person to understand that they're not broken, that in fact their brain and body is doing exactly what it was intended to do. It's just a bit outdated for the circumstances. And so we have to learn to kick in what is called the parasympathetic nervous system, which is the body's way of calming back down. And I'm afraid I did get slightly intellectual with you there, Simon.
Thank you for getting that in depth with it. I really appreciate that, and it's so impressive that a conversation in a workplace could make your body chemically react in such a way that you feel like your life is threatened by a tiger. I mean, what a cool analogy, and it gives good insight into how well you guys help somebody kick in that parasympathetic nervous system and reset their system so that they can get back into that normative functioning state. Very cool. I really appreciate that explanation. Jeff, some of the things that you're excited about the mental wellness department here at Aptiva. What are some things you guys have in the works? Where do you see this going? You guys have had great success in the last couple of years, and just give us some little insight into where you guys are going.
I think by anybody's standards, we live in a time that change is occurring rapidly, technologically and socially and many other areas of our lives. And so the general population as a whole tends to be a bit more anxious, a bit more overwhelmed than we saw even 10 years ago. But interestingly enough, with the advent of or the exponential growth of the digital world, we have tools at hand that we also did not have a decade ago. And here at Aptiva, we tend to be on the front lines, pursuing those technologies and the ability to meet our patients where they are and help them with best practices and best technology available. And so part of that is more traditional, positioning ourselves to help our patients navigate these challenges, especially an outdated autonomic nervous system that we discussed, but also to help patients learn to activate that parasympathetic nervous system, that ability to calm themselves down. And that's what I meant earlier when I said they leave our four walls with the ability to navigate life better than when they came to us, better than they could prior to their traumas or whatever the circumstances are that brought them to us. And so we're looking forward to having a neurobio feedback lab with virtual realities such as Oculus to assist the patient as they work on their mindfulness, to get that feedback that allows them to understand what their successes feel like biologically and neurologically. So we can take the virtual reality headset, put the patient into a virtual environment that is conducive to calming themselves down and learning mindfulness. We can also take that same technology and gradually, over time, expose them to situations virtually that help them practice that mindfulness. A couple of other things we're doing, by the way, with the same technology, with or without the same technology, is sleep clinics and working with you with physical therapy department to work on pain management outside of medical interventions. We happen to think at Aptiva that controlled substances is not the best approach to pain management. And so we're working on pain management programs to meet the patient where they are and help them to regulate those pain signals coming from the brain without intense medical intervention. So that's a few things that we're looking forward to, among many.
Yeah, that's awesome. And I think one time you gave me the reference of many people come to you as a thermometer, and your job is to help them recognize that they're not only a thermometer, but they can also be the thermostat, and they can adjust that temperature, and learning to recognize what it feels like to be in certain environments and then control that when they come in. So that it's very exciting, and it's very forward thinking to move beyond the diagnosis, medication, and what next to help them get out of pain. And so I appreciate you opening that up and giving us some insight into that. Jeff, it wouldn't be a conversation without telling patients how they can get a hold of you guys here at Aptiva. So what's the best route if somebody goes through a traumatic event and they need to reach out to you guys? What do they need to do?
So Aptiva is a company that's growing very quickly. And one of the things we had to implement a few years ago, actually before I came here, maybe before you came here, I don't know, but we had to implement a call center to meet all of our patients' needs. We are in 10 locations in Kentucky and are looking forward to becoming a regional company while maintaining a small practice approach to our patients. All of that to say that the patient can get online and fill out the forms there and come to Aptiva through that route, or they can call 502-909-0772 and talk to our wonderful people over at the call center to assist them in getting on our schedule.
Jeff, I really appreciate you. And every time we talk, I feel like my heart rate settles and calms down. And, we kind of get to this mutual energy state. And so I really appreciate the energy that you bring in. And thank you for taking the time today.
Absolutely. It was my pleasure, Simon. I always love talking to you.